Let's bring you this conversation now. The Gauteng Health MEC has hailed the successful launch of a measles and rubella vaccination drive at Steve Biko Primary School. This is in Orange Farm this morning. It comes as Gauteng faces a growing number of cases since 2022, with over 300 confirmed so far. Let's speak now to the Gauteng Health Department, and the division is Disease Surveillance. Mashaole Makwela joining us now for that conversation. Good evening to you, sir, and thank you very much for your time. Let's understand this measles outbreak. Let's start with how it presents, this disease. What kind of symptoms are we looking at here?
Good evening, Koli and the viewers. Measles is a disease that presents initially with fever. It will present with a rash, which is quite typical of it, and the rash will spread down, through the body. Flu-like symptoms will also follow. So those are just the initial symptoms, and obviously, if not managed, there will be complications where a person can have either, blindness, deafness, and in some instances, encephalitis. So that is normally what measles presents like, and often within the first 14 days of infection, which is the incubation period, that's where, after then the symptoms will start showing. So we say that once those symptoms have been observed in the community, we advise parents and guardians to take children to their nearest healthcare facility, to be tested and managed further.
There's also the question of vaccination. Are children, including adults, can we vaccinate against measles so that if infected, you lessen the severity of the disease?
Definitely. The vaccine has been available, in the routine immunization services for years and years now. And, children are getting it without any cost in those facilities routinely. And what normally happens is, if there is, because what we know is that, and what we have seen with the epidemiology, is mostly affecting children under the age of 15. And but at times you'd find that adults also get infected, those that probably have not really been fully immunized or they had waned immunity. Then in that case, we would also, when there is a case that is presented at a facility, do contact tracing and ensure that even adults that are close contacts are vaccinated, just to ensure that they prevent themselves from really getting the virus, or in fact having a mild infection should the infection really occur.
Yeah. Are there specific areas of concern? I'm talking now Gauteng, where the outbreak is understood to be manifesting. Are there hotspot areas, perhaps, is a better question?
Look, what we have seen is that both, all the three metros, Tshwane, Johannesburg, and the Ekurhuleni district, they've had, high number of cases reported during this phase, with less numbers in Sedibeng and in the West Rand. So our main concern is now, because if you have got 3 or more cases anyway in an area, it's an outbreak. But we had seen more cases in Tshwane, more than the other 2 metros. But at this point, we are looking to contain, and with a wide, vaccination campaign, then you are closing that bubble, ensuring that the measles is contained within the areas that is reported.
Okay, and how do people take precautions apart from being vaccinated? Are there other precautions that people can take in order to not be infected, or at least minimize infection rates?
Yeah, we always say that if you really are infected, you need to isolate and stay at home. for at least 5 days to 7 days, so that from the point where you realize that you had this rash or it has been confirmed that you have been infected, in that way you are minimizing the spread of measles, and you are ensuring that, remember, measles, it's spread through respiratory, it's a respiratory contact type of infection, where if a person sneezes or coughs, the next person around can really get infected. So we encourage those that are positive to really isolate and ensure that they also get tested to really be confirmed positive or negative.
Yeah. All right. As a final question, I notice here that the area of Mamelodi, including Winterveld in Tshwane, the reporting there is that there were some 35 and 10 cases reported respectively. And the understanding is that the department is also on a vaccination campaign in schools. Is there some kind of information you might want to share as to schools that are likely to be visited for vaccination campaigns, and what's the message to parents?
Yeah, initially when the outbreak started, that's where we started seeing a lot of cases in Mamelodi and Tshwane. And there was swift movement even prior to this campaign being conducted or started, where we ensured that we did targeted vaccination drives just to cap some of those areas that you have mentioned. And the campaign itself is really targeting, as indicated, children between the 6 months and 15 years of age. So ordinarily, those are children that you'll find in schools and in creches. So our campaign is taking place in schools, but furthermore, it is also extended into the other sites in the community, such as areas where you can find children. It can be taxi ranks, it can be in churches and in other gatherings. So we are saying to parents, please ensure that consent forms are signed, they are returned as soon as possible, so that the teams, as they come to the schools, they find children that they can vaccinate and they've been permitted to be vaccinated. But we're also saying that we're not only vaccinating for measles. In the measles rubella vaccine, so there is an addition which was made last year in 2024 of rubella. Then a majority of our children would have not received that vaccine that is containing rubella prior to 2024. So this is an opportunity for them to really get protected against rubella, which has similar signs and symptoms and even more severe consequences if one is infected.
Yeah. Just as a final question to you, sir, if, let's say, you miss that vaccination drive, can you go to your nearest pharmacy, your nearest clinic, in order to get yourself protected?
Oh, definitely. As I've indicated, this is provided routinely, in all our public health clinics and even in hospitals. So should you find yourself that you require a dose, even post the campaign, you are more than welcome to really go to the facilities near you and ensure that you get that dose. That is really important. And these are just booster doses that you need to really acquire full protection, which is why we have been having the outbreaks, because population would have not really been fully, protected or immunized.
Mashaole Makwela, thank you very much for your time and information given to us tonight. Important message around the vaccination drive that is on the go to protect against these measles. But if you are already experiencing the symptoms, the advice is to go to your nearest health facility.